Good afternoon, everybody. Welcome to the City of Toronto's daily COVID-19 media briefing for Tuesday, March 31st, 2020. Joining us today, Mayor John Tory, Dr. Eileen de Villa, Toronto's Medical Officer of Health, and Matthew Pegg, Fire Chief and General Manager of the City's Office of Emergency Management. When we're finished with remarks, we'll move online. All reporters are now online, and so we will go through question by question with hands up. We will get to everybody. I ask you to please limit your questions to one plus a follow-up. If you have another question, we can come back. Mayor Tory.
Well, good afternoon. As we continue to fight COVID-19, it has become increasingly clear that this is going to be a very long battle. Indeed, much of what we have been asking people to do by way of physical distancing and isolation is about saving lives and protecting health, but also about giving you your lives back. I believe that throughout this fight, it will be important to be honest with people about the length and complexity of the battle. That's how we will ensure that residents follow the advice of our medical professionals and work with us to stop the spread of COVID-19. Earlier today, the province announced that public schools will remain closed throughout the month of April. I am announcing today that the City of Toronto's facilities will also continue to be closed until further notice, including non-emergency city childcare facilities in schools. City-operated programs will also continue to be cancelled. This is based on recommendations from Toronto's Medical Officer of Health, Dr. Eileen de Villa, to help slow the rate of COVID-19 infection in Toronto and protect everyone, including our vulnerable populations, seniors, people with compromised immune systems, and individuals experiencing homelessness. As we have throughout the crisis, the City remains prepared to respond to emergencies. Emergency response by Toronto Police, Fire Services, and Paramedic Services is not impacted. I want to thank our frontline city workers who continue to deliver essential and critical services to our residents. The TTC is still operating for essential workers who need it. TTC CEO Rick Leary told me today that he will be moving buses onto the 8 busier bus routes to better manage overcrowding, and that is happening at the express direction of the TTC CEO. They are adding buses where there is overcrowding to manage routes and get people where they need to get to in a healthy way and in a safe way. Safe, clean water is still coming out of your tap. Public health workers are responding to the pandemic. Shelter workers are caring for the homeless, and your garbage and recycling are still being picked up, and all of that will continue. The City of Toronto also continues to provide many other services to its residents, including, in particular, those who are most vulnerable. But we know this pandemic is changing how we go about our daily lives in our city. And that will also mean many of the events we treasure in our city every year will not be able to go ahead as scheduled this year. Due to the COVID-19 pandemic, the City of Toronto is cancelling all city-led major events, festivals, conferences, and cultural programs, and is also cancelling all city permits for major events organized by external groups at civic centres, squares, parks, public spaces, including road closures, city-operated museums, and cultural centres, and all of those permits will be cancelled through June 30th. This is not an easy decision to make, but it is necessary to protect the public and to save lives. It also gives clarity to the event organizers and residents, all of whom have been communicated with, some of whom had already taken steps to postpone their events. While we treasure many of these events and the important contribution they make to life in our city, protecting the health and safety of Toronto residents has to be our primary concern right now. This decision has been made again in consultation with Toronto's Medical Officer of Health, the Emergency Operations Centre, and the Toronto Police Service, and supports the directive that physical distancing, staying at least 2 meters from other people, is absolutely critical to stopping the spread of the COVID-19 virus. This is also in line with the province's emergency order under the Emergency Management and Civil Protection Act to prohibit organized public events and social gatherings of more than 5 people. Many of these events, of course, involve thousands of people, sometimes hundreds of thousands of people, and it is doubtful that the health environment will be where it needs to be on the originally scheduled spring dates if these events are to happen in a healthy, safe, and stress-free way. One of the biggest events of all, one of our signature celebrations, is of course Pride. I spoke with representatives from Pride Toronto today, and I thanked them for their understanding of this decision and expressed my own enthusiasm for Pride Month, which will still proceed in June, so stay tuned. I know that these measures are hard. Festivals and events are treasured moments in neighborhoods across the city, but the sooner we heed the advice of our medical experts on a consistent and sustained basis, the sooner we can get back to the things that we all enjoy and love. If getting back jobs and incomes and festivals and sporting events and concerts is something that you are really looking forward to, then the closer we follow the direction of the Medical Officer of Health, the sooner that we will get all of those things back. And I should say that as we continue to plan and work with partners and stakeholders, I expect there are more decisions to come which will save lives, protect health, and give you your lives back at the earliest possible date. It is our duty and our obligation to you to take those measures as we have done to date. I want to reiterate again today a message to landlords and to tenants. Tomorrow is April 1st, and many residents and businesses have rent to pay. While the city does not have the power to compel landlords to help tenants who have lost their jobs due to the pandemic, I strongly urge landlords to work with their tenants to help them stay in their homes and business premises. If you've not done so to date, it is still not too late to talk to those tenants and to give them some comfort and some reassurance that you can find a way to help them. I would also express the hope that landlords for businesses forced to close during the pandemic will be equally understanding. Many landlords have already stepped forward to do the right thing to help tenants, and I would encourage others to be just as accommodating. These are unprecedented times requiring unprecedented actions. I would also say to tenants and property owners, if you still have your job and your income, please pay your rent or your mortgage payment or your property taxes. While deferrals are fine and much needed for those who are in trouble, they can cause difficulties for businesses or governments if everyone took advantage of them. I know we all want this to be over as soon as possible. I am in constant contact with our public health experts, the provincial government, and the Government of Canada about how we can respond to this emergency and how we can end this pandemic as quickly as possible. The other governments and their leaders have been consistently good partners for Toronto during this emergency. We are all in this together. And we will only be able to get through this and reopen city buildings, businesses, playgrounds, restart our economy, get our festivals back, and celebrate life in our city again by stopping the spread of COVID-19. I urge everyone to follow public health's strong advice to stop the spread of this deadly virus. Keep your distance from people at all times, stay home as much as possible, and follow all of the other advice and directives that you have been provided with. Please do it for your own health. Please do it for the health of your family. Please do it for the health of your neighbors. Please do it for the health of your city. And I'm now pleased to call on Dr. Eileen de Villa for her update for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 1 o'clock this afternoon, there are 793 cases of COVID-19 in Toronto. This includes 628 confirmed cases and 165 that are considered probable cases by Toronto Public Health. There are 65 cases in hospital and 33 in intensive care units. Approximately 25% of these cases are attributed to community spread, and 43 have recovered. There have been 8 deaths in total, and I extend my sincerest condolences to the families and friends of these individuals. These numbers, as you've heard me say, are constantly changing, and they will increase in the coming days and weeks. The only way we can reduce the impact is for every single resident in our city to do their part and to stay home. The lives of our essential workers and the lives of our most vulnerable citizens, their lives are in your hands. It depends on each of you and your actions to make a difference and to save lives. We know that the virus spreads from person to person when they enter into close contact, that is closer than 2 meters or 6 feet. People moving around in our community, coming into close contact with each other, is exactly how COVID-19 spreads. I've been stating repeatedly the importance of physical distancing, and I am truly disappointed that there continue to be people in our community who are simply not listening. I hear stories of people selfishly going for walks in large groups. These short-sighted actions, these selfish actions, impact everyone, and they do have consequences. People ignoring our instructions, there are consequences. Essential workers are getting sick, and others are dying in our community. This is simply not acceptable. Practicing effective physical distancing, practicing effective social distancing, means that you are to only go outside if you need to either access health services, shop for groceries or medications at the pharmacy, walk pets as required, get outside for daily exercise or fresh air, or to support vulnerable community members in meeting these needs. When you are outside taking care of these essentials and meeting these needs, you do need to maintain 2 meters distance from everyone, with one small exception. If you live in the same household, you can walk side by side, but only in groups of no more than 5, and not with members of your household who are sick or under self-isolation. Some have asked, can my child play outside with other children in the neighborhood? The answer is simply no. For the safety of your child and for all others, this kind of interaction, these kinds of interactions with others must be avoided to prevent virus spread. Others ask, how often can I go out to get groceries or other essentials? And simply put, I am asking people to minimize, where possible, the number of times each week that they go out to get groceries or other essentials like medicine. Ideally, once a week, and if available, even better, to obtain those essentials by ordering online. Each time we leave our homes, we increase the risk of virus spread. I can tell you that I am making sacrifices. We know that essential workers are making sacrifices. And all of this is done to protect our city. We all need to make sacrifices in this new world in which we find ourselves living. The decisions that have been taken, as you've heard Mayor Tory say, these decisions are extremely difficult and are often made with a heavy heart and as a last resort to protect our city. There is no alternative in the current situation in which we find ourselves. We continue to monitor our situation, but given the increased number of cases, the increased hospitalizations, and the increased deaths that we are seeing in places like New York City, just to the south of us, I am concerned that this may be our reality unless we move to stronger measures. The only way we can reduce the spread of the virus is by staying home and away from other people. It will not be for forever, but the longer it takes for us to comply, the longer this is going to last. I need each and every one of us to make our very best effort, now to prevent the situations we are seeing in other jurisdictions. I am in active discussions with all of our partners about the potential for other increased measures, and I will soon share what that means and what that looks like. In the meantime, I encourage you all, please stay home, stay safe, and take care of each other. And I'll now hand it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. I'll be very brief today, providing an update on the enforcement activities in parks amenities and compliance with respect to businesses, restaurants, and bars. As both Mayor Tory and I explained in detail yesterday, there are fines associated with violating the park's amenities closure, which is now also covered under provincial order. As always, education is the first line of enforcement, and our bylaw enforcement officers, together with Toronto Police, will continue to ensure public understanding before issuing fines. Tomorrow, approximately 60 additional bylaw enforcement officers are being deployed to work on the enforcement of parks amenities closures. They will focus on hotspots where we see the most activity around non-compliance. Parks ambassadors are also patrolling hotspots, and staff continue to reinstall removed signage, locks, and caution tape that have been removed. Since March 24th, municipal licensing and standards have received 597 complaints related to the use of parks amenities, and police have issued 9 tickets in the amount of $750 each for non-compliance with parks closure directives. The current weather at present is helping with compliance. With respect to the enforcement of the provincial order around businesses, restaurants, and bars being open, since March 24th, Municipal Licensing and Standards has responded to a combined total of 496 complaints and issued 23 notices and 10 warning letters. Finally, I want to take this opportunity to thank all of the city staff who are working in our shelter system, including those staff who have been redeployed to work in the shelters. The city is taking and continues to take extraordinary measures to protect our most vulnerable and to ensure they remain as safe and healthy as possible. These are indeed extraordinary times, and I'm heartened each and every day by those in the Toronto Public Service who are doing everything they can to help Toronto get through this emergency. Thank you.
Thank you, Chief. First question is to Natalie Collada from the CBC. Go ahead, Natalie. And again, remind everybody, sorry, Natalie, just remind everybody, one question, one follow-up, and then we can come back if necessary. Sorry, Natalie, go ahead.
Thank you. We were told yesterday that a hotel at an undisclosed location in Toronto was going to be used as a center to house people who are homeless who have tested positive for COVID-19. However, today we were told by some medical staff who are running that facility that that is not sufficiently safe space to do that, and that to care for long-term people who test positively with COVID-19. Can you or someone perhaps clarify what exactly that space is being used for?
So Marianne Bedard is here from Marianne is our General Manager of Shelter Support and Housing Administration, and she will answer that question for you.
Thank you, Natalie, for the question. So yes, I mean, this is the next step in our tiered response, focusing on prevention, mitigation, and recovery. We've spent a lot of effort putting into place as much prevention as we are able to do, creating temporary spaces in community centres so we can alleviate the capacity in our respite programs, making sure that we are providing our community partners with resources to secure some PPE, also providing them with some guidance with our public health partners about how to create social isolation in the shelter system. We're now moving to the second phase of this, which is about mitigation. And mitigation includes our plan to rapidly increase the number of shelter hotel beds available to increase physical distancing in the shelter system. But we know that as we're doing this, we also continue to get a high number of people who are being tested for COVID-19. This does put an extreme pressure on our healthcare system, and we want to make sure that we work collaboratively with our healthcare system. So we have identified a site where, as people are waiting for their test results, they can wait for those test results. If they are negative, they will return to the shelter system. And if they are positive, they will remain on site and receive medical care as well as care from shelter staff. Our staff are on site today and ready to receive clients as soon as working with, many of our health partners, we get those medical supports in place. And we continue to work with those medical partners to think about, again, what's next. It's really important for us to stay one step ahead. And we know as we move through this pandemic and as it impacts the City of Toronto, we will need likely a larger facility. And so we will continue to work with our partners on creating a site that is exclusively for COVID positive people who would not arrive until they were positive, as opposed to a mixed setting, which is what will be at the current location.
So just as a quick follow-up to clarify, the individual, the current site, if someone tests positive for COVID-19, they will remain there, or will they be moved to a shelter?
They will remain as long as their healthcare needs can be met. Their healthcare needs exceed what we're able to meet on site, then obviously we will engage our health partners and move that person to a hospital, but they would never be returned to the shelter system.
Okay, we'll go to Matt Bingley next from Global News. Matt?
Dr. de Villa, can you hear me?
Yes, we can hear you.
I just wanted to clarify something before I actually get into my question. You said that there were 2 new deaths. I know that one is from a long-term care home. Can you tell me anything else about the other?
So actually the deaths that, the additional deaths that I'm talking about today are separate from those that I believe you're speaking about. And as you know, Matt, I don't get into the personal details or the individual details of these cases. There are long-term care situations that are happening, and I understand that there have been some recent deaths that were reported not that long ago, literally less than an hour ago to my knowledge. And so the investigations are proceeding. I don't have much by way of detail to report at this time, but will inform you as more details come to light.
So even with that one reported within the last hour, is 8 still the most accurate number you have?
Matt, I think these are information, these are the data as of 1 o'clock this afternoon. It's right. That which was reported within the last hour or so is not reflected in these numbers.
Okay. Well, just to my question then, when it comes to a long-term care home, I was speaking with one that did experience a death last night. They said that one of the issues that they have to deal with is the fact that the individual who died, along with all 3 of the other residents who are COVID positive, were sharing rooms, and that they actually have a similar situation within their facility where they don't have space to sort of split people up. Now, just in the past, you've said that long-term care homes are well suited for an outbreak, but with now 6 outbreaks in the city in long-term care homes, are you still satisfied with the city's or Toronto Public Health's ability to respond to that and manage those outbreaks when some don't really have the space to split people up?
So Matt, you mentioned the point that long-term care homes are well suited to outbreaks. I would take issue with that. Long-term care homes are not suited to outbreaks, and in fact, when it comes to COVID-19, we know that this is a disease that has particular severity and particular impact on an older population, and we know that the residents of long-term care settings tend to be on the older end of the age spectrum. So in fact, one of our major objectives has been to minimize the possibility of COVID-19 entering into long-term care settings. And we've undertaken a great deal of work. We work hard all the time, but particularly with COVID-19, we're always working around ensuring that infection prevention and control measures are well applied in the long-term care setting because of the vulnerability of residents there. So there are very well-established procedures, and those procedures were reviewed with COVID-19 in mind with our long-term care setting. Everything from enhanced cleaning and disinfection, enhanced surveillance and monitoring, active surveillance of staff, closing down those spaces to visitors, ensuring that those who do have COVID-19 are isolated to the extent that they can be. And each home, we know, has its own unique circumstances, but I can tell you that the team at Toronto Public Health has been working around the clock with long-term care partners, and certainly any case in a long-term care home, whether it impacts on a staff person or a resident, is considered very high priority by us at Toronto Public Health to manage as quickly as possible.
Thank you. We'll go to Austin Delaney now from CTV News. Austin, go ahead.
Everything from enhanced cleaning and disinfection, enhanced surveillance and monitoring.
Sorry, I'm not sure who that was. Next is Austin Delaney from CTV.
Do have COVID-19 or isolated.
Sorry. Okay, we'll go to, sorry, just a little technical difficulty. We'll come back to Austin. Francine Copen from the Toronto Star.
Oh, hi, good afternoon, everyone. My question is for Dr. de Villa. You said that there are 33 people in intensive care. I'm wondering how many intensive care beds we have in Toronto.
So Francine, I actually have to check that number with our healthcare partners. I know that they've made a number of adjustments within the system, so I admit I have to get the most current number from our hospital partners.
Can we get a rough idea? I mean, is it in the hundreds or?
So it is, I believe, in the hundreds, but I don't want to be more precise than that. I know that there have been a number of changes and adjustments made specifically by hospitals in preparation for COVID-19. So I do believe that our partners at Ontario Health, and in particular the Toronto Region Office, would have the most up-to-date statistics around what's happening in hospitals for Toronto.
Can I ask a follow-up?
Yeah, go ahead, Francine.
How likely is it that we will find ourselves in a situation where we have to open up new temporary hospitals and parks or other spaces, as is being done in New York City?
So, Francine, if we can all do our part, if we can practice effective physical distancing and social distancing, and continue to abide by the recommendations that we have been making for several weeks now, my hope is that we avert that, and that is the objective that we're trying to achieve here, is to flatten this curve such that we are able to manage those cases that present with COVID-19, and those in particular that require hospitalization and intensive care within the existing capacity and resources that we have here in the city and throughout the province. That's been the objective all the way through. So that's why we continue to urge members of our public to maintain that 6 feet distance, maintain that 2 meter radius, to stay at home as much as possible, only going out for those essential needs, so that we can find ourselves in a situation where we are able to manage the impact of this disease on our community.
Okay, go to Mark McAllister from City News. Mark?
Mayor Tory, if you could, we're just looking to get some clarification on the daycare announcement that happened this morning. The number of spaces versus the number of applications, there seems to be many more applications at this point than there is spaces. Is there any intent to expand on the number of spaces for children at these emergency daycares?
We'll have Shanley come and answer that question for you. Thank
Mark,
you.
Shanley McNamee from our Children's Services Division is here, and she can help you with that answer.
Yep. Thank you for that question. Yes, we opened our 4 emergency childcare locations today. It was our first day operating. The demand has been high, and we're continuing to monitor. We've only opened the application on the weekend, so we have an idea of what the trends are, but we want to give it a few more days. Once we are fully aware of the demand, we do have plans to expand to additional licensed childcare centers, but very closely following the direction from Toronto Public Health and our occupational health and safety to make sure that any expansion would meet all of the required health and safety protocols and that children and staff would be safe.
And just a follow-up question to Dr. de Villa, if I can. Once again, you are urging people to try and keep their distances, only walk with family members when they're outside, if they happen to be going outside, which you don't want people to do. Yesterday, you made a quick reference, and this may be a basic question based on stuff we have been told from the beginning, but you referenced the amount of time it takes in the presence of someone else for this to be contracted. And you had said something along the lines of a prolonged amount of time. Could you clarify what the difference is between prolonged amount of time and simply walking by someone on a sidewalk?
Well, you know, in the outdoor environment, the likelihood that you actually contact, especially as you're just passing by somebody quickly, the likelihood of encountering the respiratory droplets that come from somebody's cough, sneeze, or when they talk or speak to you is considerably lowered compared to when having that interaction indoors, simply because of the airspace. But the idea here is that we know that the virus is spread through close contact, and you have to have close contact with the respiratory droplets or secretions from somebody's nose or mouth. Those droplets and secretions are put out every single time they talk or breathe, but especially when they cough or sneeze. It's that kind of action that more effectively propels those respiratory droplets and secretions. And we know that they travel about 2 meters. That's why we talk about that, maintaining that 2-meter distance. So when it comes to walking outside, whether it's to pick up essentials or to get that, that little bit of fresh air, that bit of daily activity, if we're talking about, so you mentioned family, I would actually suggest it's around your household members, the people that you actually live with and who you share that indoor space with. You're already sharing the indoor space, so it's actually reasonable, particularly in the case of parents and children, to go outside together. Particularly for young children. But again, virus spread is through close contact with the respiratory droplets, secretions, the stuff that comes out of people's coughs or sneezes. That's how COVID-19 is spread.
Okay, we'll go to Jeff Gray from the Globe and Mail. Jeff?
Oh, hi. Yeah, my question, I guess, is for Marianne Bedard.
She's just coming to this chair now.
About the homeless situation.
Go ahead, Jeff.
Hi, Marianne. Hi. I just want to ask you mentioned that earlier we were told that there was a isolation center for people awaiting tests, and then a place where you go once you've been tested if you're homeless and you need a place to be when you're positive. Now we're hearing that there's actually 2 isolation centers. When did this change? When did this approach change?
Thank you for the question, Jeff. Well, we've always remained nimble in our response. How this virus spreads through the homeless population is something that people just didn't know. So we wanted to make sure that whatever plans we put in place, we were able to adjust, scale, change, depending on what was happening. So we did open an initial isolation site for people. It had the capacity of between 30 or 40 people. And at the beginning, when testing was mostly focused on people who had a travel history, we had a very low number of people experiencing homelessness, obviously, that were tested. Recently, the Ministry of Health changed that advice and included people experiencing homelessness because of their ability to live in a congregate setting and the likelihood that within that setting there might be higher levels of spread. And so with that, there was a marked increase of the number of people that were being tested, and it was certainly putting a lot of pressure on our hospital system. So that was one of the reasons why in this second site, as we planned, for it to be strictly for people who had already tested positive, we wanted to be nimble and shift and be able to accommodate that change to be able to respond to the number of people that were that were being tested, because we were not going to be able to accommodate them in a small site of 40. So this larger site gives us the ability to do that, to be responsive, to provide a place for people to have isolation during that period while they're being tested, and that helps us ensure that we minimize as much as possible the amount of spread in the shelter system. As test results come back, you know, we've been extraordinarily lucky so far. A large number of tests, majority of them all negative. The reality of this population is we know that will change over time. So again, we always want to make sure that we remain that one critical step ahead of this virus and its impact on the homeless population. So, you know, we have a mixed model now that we are opening to take us through this next short period. But already we are starting to work on the larger facility that will be strictly for people who have COVID-19, where we can make sure that we take care of those needs.
Do you have a follow-up, Jeff?
When will you open that one then? I mean, if you're staying a step ahead of this, we're looking at a week, or how long will it take to open the second facility?
So we're working really closely with our health partners and our facility staff. We will be using a city building. We're right now just putting in the infrastructure requirements, working out what the staffing requirements will be, what the medical model is, and, you know, doing this all rapidly and in real time. So I would anticipate, you know, in the coming weeks we will have something available. But until then, we are confident that we will be able to accommodate the people that will be undergoing testing, and unfortunately the ones whose tests come back positive, to ensure that they receive appropriate care and the shelter system receives the appropriate protection from further spread.
Okay, we'll try Austin Delaney again from CTV. Austin, you there?
Hi there. Yeah, if you can hear me. This is a question, please, for the Mayor and also Dr. de Villa. We have a Facebook posting from a nurse at St. Joseph's, begging for some help, begging for face shields. And she's been told to take it down by her employer. She's worried she's going to get fired. And I'll read what she says. I'll take the risk of sharing the video because I love and appreciate all my colleagues at St. Joe's. I don't want to see any of my friends die, and I don't want to die. It's like going to war without weapons and armor. Any comment on that, the possibility that she could lose her job and the fact that there's not enough supply?
Well, I'll start by saying that no person should be afraid that they're going to lose their job because they speak up with legitimate concerns they might have about the environment in which they're working, especially people in the healthcare system. Secondly, I will say that the question of supply, especially in different parts of what is a very complex system, parts of which the city is responsible for, parts of which the province is responsible for, is complex, and therefore there is not a simple answer to say, well, we can satisfy that person's concern. In fact, there's a real question as to what our level of responsibility would be for that, and that's not trying to dodge it. It's just saying that sometimes you're not even able to participate in that decision making. But I'll ask Dr. de Villa to comment on the question of the circumstances in which healthcare workers generally would work without being able to comment, obviously, on that specific case, I'm sure.
So, thank you, Mayor Tory. When it comes to these situations in the hospital, I know that there has been and there have been challenges with respect to personal protective equipment. And, you know, I would agree with the Mayor that people should raise legitimate concerns and shouldn't fear reprisal for that. I think that's a responsibility we have as health professionals, and it's one that we should hold dear and continue to maintain. I know that this is an issue, again, with respect to how hospitals themselves are supplied, not really within the purview of the city. This is something that is outside of our control. However, we are aware of these issues. I have heard of challenges with respect to supply, and I do bring those challenges, those concerns, and the issues as I hear of them to the necessary partners, to the partners who have greater purview and, frankly, responsibility for managing those concerns. So I would tell the individual that, yes, we have heard similar concerns, and we're making sure that those who are in a position to address them and who need to be aware of them, we're making sure that they do know of these circumstances.
And I think to put a fine point on that last point that Dr. de Villa made, if people feel they have no other place to turn because they've raised these concerns and found there hasn't been responsiveness, even though these areas are not our direct responsibility as a city or even as a medical officer of health for the City of Toronto, bring them to our attention, because we have to have an environment in which people working within the healthcare system or in long-term care or anywhere else feel comfortable raising those concerns and feel comfortable to come to work. We badly need those people to continue to do their jobs, to look after all people who are ill, not just those with COVID-19. And so if there's no other place to turn, then turn to us, and we will at least try to advocate on your behalf and make sure that those concerns are addressed in whatever manner is suitable to the institution concerned.
Do you have a follow-up, Austin?
Just to follow up, the frustration you must have that people just don't seem to get this, stay away from each other. The lineups at grocery stores, people in threes, huddling together. How frustrating is that to see things like that?
Well, for me, it's massively frustrating, because I think, and this is not to flatter her, the medical officer of health is so clear and articulate in telling people again today in even more detail what they should do and what they shouldn't do. And if we were dealing with children here who were going onto a playground, as children will do, and going on equipment they shouldn't go on and ducking under the yellow tape, I'd say, well, you know, kids do those kinds of things. We're dealing here with adults who consciously, in some cases, violate the space that through orders of the city, legitimate legal orders, people have been told not to do. There's signage, there's tape. When it comes to the grocery stores, I think many of the grocery store companies have done a great job of marking areas out, of controlling lineups, and then there are people who just decide those rules don't apply to me. And so if everybody did that, we would have utter chaos, we'd have loss of life, we would have many more people sick, and we'd have a lot longer a period of time before we get our lives back. And so to me, it's immensely frustrating that people who are supposedly adults, supposedly are well informed, especially in this day and age where everybody knows everything within seconds of it happening from their phone, there is no excuse for this behavior whatsoever. I hope the fines will help, but you really have to hope that common sense and consideration for other people in the city and consideration for how we can stop loss of life and keep people healthy and get our lives back will be enough to get people to cut this out and to start to behave in a way that is commensurate with how we behave in Toronto.
Two more questions. Matt Bingley, you have another from Global?
Yeah, sorry. I just wanted to clarify one thing, because I know that there are concerns about privacy, but in the past, Dr. de Villa, you've said that individuals have died in hospital or in other areas. So I'm just wondering if you can just tell us if they were at a hospital, these latest deaths, or something, just to simplify it a little bit more.
So, Matt, I'll be happy to bring you those details at a later point. I know that I've received and I continue to receive information from the team. They're continuing to investigate. So at this point, I don't have further details to share with you, but I shall undertake to share those with you at a later date.
Okay, I appreciate it. Thank you.
Okay, Natalie Clada, you have one last question. Go ahead, please.
Sorry. Yes. Hi. Thank you. It's for directed at Marianne. If she's still there.
Yep. She'll just come to the microphone. Just give us a second. Okay, Natalie, go ahead. Thank you.
Thank you. This is in relation to the quote recovery center that we were told was open today. And Marianne, you mentioned just when I spoke last time, just now, that if a homeless individual who was tested positive for COVID-19 while waiting for the test result at this undisclosed hotel will be allowed to stay there if a doctor says that they can handle that. Isn't it slightly misleading to suggest that when the medical community and the partners involved in this are saying that they currently right now do not have the ability to do that safely? Furthermore, they are not funded, and that center itself is not mandated and designed to make that happen. So isn't it misleading to suggest that homeless individuals who have COVID-19 can recover there when it's not the case, when it's most likely they will be sent to a hospital because they simply don't have the equipment and the necessary functions to make that possible?
Thank you for the question, Natalie. So, there are going to be situations where somebody will need to go to hospital. We also recognize that the hospital is going to be under considerable strain. We want to make sure that people experiencing homelessness who are tested positive, that don't have severe symptoms, have a place to recover from this illness. And if their symptoms are not severe enough, there is not going to be capacity for the hospital to provide care, because they'll be providing care for others who need it. And it will not be possible for these people to go back to the shelter system because of the opportunity they have to spread the virus. So it is vitally important that we provide a place for them to do that. We will continue to work really closely with our health partners. If there are things that we need to change or adjust, as I said, our plan remains nimble and responsive to the issues at hand. And we'll continue to take that medical advice from many of our medical partners, the inner city health associates, but also our community health partners at Ontario Health, University Health Network. There are, an incredible amount of people that want to make sure that the very best services are provided to people experiencing homelessness, because we all share the common goal of making sure that we minimize the impact as much as we can on this very vulnerable population who will be particularly hit by this respiratory infection. So we are working collaboratively together with one unified goal, and we will continue to do that.
All right, thank you everybody for attending. We'll talk to you tomorrow.